Looking for cosmetic treatments that offer real results without breaking the bank? Today, I'm sharing what I think, as a cosmetic dermatologist, are the most cost-effective and efficient treatments you can get. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California, and I'm really here to help you find products, and in this case, procedures that work for you. So if that sounds good and you like that type of content, make sure you're subscribed to the channel and give this video a thumbs up. You know, the reality is, as a cosmetic dermatologist, when I'm talking with patients during a cosmetic consultation, it is always my goal that they get the most value for the least amount of spend. These quote-unquote bang-for-your-buck procedures are really what I start out recommending to my patients because I know they're in my office because they want to see real results. The cosmetic industry, whether we like it or not, is really considered a luxury industry. It's generally for people who have some type of disposable income because most cosmetic procedures are running people hundreds to, if not thousands of dollars. So when we're talking about things that are cost effective, that doesn't necessarily mean they are cheap, but in the grand scheme of what you could spend in a cosmetic office, they are more efficient with how much improvement you may see in a single session. Other things to keep in mind are when I'm doing a cosmetic consultation for someone, the things that I recommend are the things that I think are going to be the best for helping them reach whatever their cosmetic goal is. And of course, I absolutely can respect when someone has a budget, as most people do, but I don't want to change what I'm recommending or what I think is medically or aesthetically appropriate based on budgetary concerns. It doesn't mean we can't make adjustments to the cosmetic plan, but when I'm first evaluating someone, I'm truly trying to decide what I think would really make the most impact for them and get them to their aesthetic goals, regardless of cost. And ultimately, it is such a personal decision what a patient wants to invest in this aspect of their life. Other things that you might notice when it comes to spending on cosmetic procedures is that when you're having treatments done by a board-certified dermatologist, a board-certified plastic surgeon, someone who has advanced training or expertise in an area, you are generally going to be paying more for that service compared to if you had that treatment done in a medical spa, for example. That's not true across the board, but oftentimes you will be paying for that additional expertise or safety or desired aesthetic outcome. Also keep in mind that just because something offers you the most bang for your buck doesn't necessarily mean it's the right treatment for you, which is why it's so important to have a relationship with a cosmetic provider that really has your best interest at heart and is not just trying to sell you the cheapest thing. And then the other thing I feel inclined to say, because a lot of people who come into my office for a cosmetic consultation are actually already doing quite well with their skin and they look really good, is that if your skin is already in a good spot, the amount of bang you're gonna get out of your procedure is going to be modest because your skin doesn't have that much more improvement to make. Ultimately, I completely respect that people do not want to waste their money. They want to be spending it wisely, and that's what this video is here for. But I will caution you that your face and just cosmetic treatments in general are not a place to bargain hunt. Okay, now that I have all my caveats out of the way, let's get into those treatments where you are going to see significant results even with just a single intervention. I think number one bang for your buck procedure, and I think a lot of cosmetic practitioners would agree with me here, is Botox. If you're unfamiliar with Botox, it is an injectable that is used to relax muscles of the face. And the whole reason we're relaxing them is because when you repeatedly activate certain muscles, for example, you repeatedly scowl or you repeatedly raise your eyebrows, it can begin to etch in lines into your face permanently. And so we're really using Botox to help fade away the lines that are due to repeated muscle movement. The reason I would say this is relatively cost effective, again, everything is going to be relative, nothing in cosmetics is really cheap, is because immediately after you have Botox, well, not immediately, within a couple weeks of the Botox kicking in, you will see that those lines do start to fade away. When certain muscles in your face are relaxed, it's really obvious. It's a very, very tangible result. So for example, it's like you were able to scowl 2 weeks ago and now you really can't. And I think because this is such a black or white result for people, it's why Botox is often an introductory cosmetic procedure for so many people, even those who are on the younger side. Now, the cost of your Botox is going to vary based on a lot of things. Probably first and foremost, where in the country or in the world do you live? If you live in a high cost of living area, your Botox is likely going to be more expensive. Other things that determine the cost of your Botox are how many units you're getting, so essentially the dose of the Botox, as well as how many areas on your face are being treated. And practices will charge you differently as well. Some practices might charge you per unit that you're getting, so you might be paying $12 or $15 or $20 a unit, and some practices will be charging by area. So it's just a flat fee of $350, for example, to treat a forehead, or $450 to treat a neck. Now, even though I think Botox is really satisfying and it can be so transformative for someone's face, one thing to keep in mind is that it's not permanent. Botox usually lasts for 3 to 5 months, depending on your physiology and the dose that was used, and sometimes even the technique. So if you do like what it does for your face, you do need to repeat it to keep those results. Often I explain Botox like getting your hair highlighted. Like, if you like it and you want to keep it up, you got to keep doing it, and you can go longer in between your treatments, but that also means you don't get to get the aesthetic benefits for as long. The other thing that's really nice about Botox is it's a super quick procedure, so you don't have to take time off work. There's no downtime for it. So that also makes it efficient and cost-effective in a lot of ways. A couple of other procedures that I think are relatively cost-effective are lasers that target brown spots or red spots in your skin. So for example, a pico-way laser, which is a specific type of laser that targets brown spots. A single treatment for a single brown spot is usually a one-and-done procedure, meaning that once you treat that single brown spot, it's usually gone forever, or at least for several years. I have some cosmetic patients who are not interested in full laser resurfacing, even if they have a lot of sun damage, for example, but they might have 1 or 2 larger brown spots on their cheeks or their nose that they really want to focus on, and using a laser like that can be very satisfying for them. And then that doesn't come with the same cost and recovery that a full face laser would. Lasers like this that target brown spots still do have downtime. It's usually a week for that spot to heal up, but if it's just 1 or 2 areas on the face, it's generally a lot easier to go on living your life like that rather than having to take a few days off of work if you had a full face done. Treating a couple of small brown spots can really range in cost. Usually you're looking at somewhere between like $300 and $600. There's also lasers that help treat red spots. So for example, a V-beam laser or a pulsed dye laser, which is what I have in my practice. And again, sometimes I'll have a patient who maybe has some other cosmetic issues going on, but they have like a single cherry angioma, which is a bright red spot, or a single spider angioma, which is like a little radiating broken blood vessel right on their cheek or right on their nose, and it would just mean the world to them to just get rid of it. And those things usually cost a few $100, and they do it one time and then it's gone forever. So that can be a really nice instant gratification type of procedure that people don't have to spend a ton of money on. Now, sometimes people do have lots of red spots and lots of brown spots in their skin, and something that's quite efficient for treating that is something called IPL, also known as intense pulse light. It's also known as BBL or broadband light. This is not technically a laser, but works kind of similarly. It's pulsed over the entire surface of the face to help lift reds and browns out of the skin. And in the grand scheme of things, it's usually not super expensive compared to lasers. One treatment of a face may run you somewhere between $400 and $800. Oftentimes people need more than one treatment to see optimal results, but generally every time someone has an IPL done, they're going to see a pretty marked improvement. I also like this treatment a lot because it doesn't have a ton of downtime. Some people will get a little bit of swelling. Your brown spots do become more prominent for a few days, but usually you could go back to work or do a social event the next day without issue. Another thing that can be pretty helpful with resurfacing the skin and addresses brown spots but also texture to some degree are chemical peels. And when I'm talking about a chemical peel in this case, I'm not talking about a superficial glycolic acid or salicylic acid peel, for example. I'm usually talking about a medium depth chemical peel, so something that goes deeper in the skin, like a TCA peel. TCA stands for trichloroacetic acid. It comes in a variety of concentrations, but when you use it in a higher concentration, between like 20 and 35%, you can get some pretty significant peeling and rejuvenation of the skin in a single session. Depending on who performs your TCA peel and how aggressive they're being and what kind of follow-up they want for you, a TCA peel can run anywhere from $500 to $2,000. But you can also have very different results depending on who is executing your treatment and how aggressive they're performing it. Even though I think TCA chemical peels can offer really nice rejuvenation, I actually find that they're not that popular in my practice because the downtime is a full week of intense peeling. I'm not talking like little flakes, I'm talking like sheets of snake skin. And for me, a dermatologist, that does not bother me, although the downtime would be problematic, but the skin itself peeling would not gross me out or anything. But for a lot of patients, having to take care of their skin as it's peeling off is definitely a deal breaker. So I do think this is relatively affordable for the degree of resurfacing that you get, but you have to keep that downtime in mind. I have a couple more procedures to share that I think are really impactful relative to the amount of money you're spending. So if you're liking this video so far, make sure you give it a thumbs up and you're subscribed to the channel. One procedure that I find to be incredibly transformative for people is chin filler. And I'm not saying everyone needs chin filler, but a lot of people have a slightly recessed or set back chin, or just like a structurally deficient chin where it's not balanced with the rest of their features. And by putting filler, which is a space occupying gel, something that's going to add structure to the lower face into the chin, transformative. Most of us, when we're looking in the mirror, we're looking at ourselves head on. So sometimes it's hard to appreciate deficiencies in the jawline or in the chin. But if you ever get a picture of yourself from the profile, or you just realize that most of the world is not looking at you head on and is looking at you from a variety of angles, you may start to realize that having appropriate structure in the lower part of your face can really balance and harmonize your features and make you look more attractive. And you can make a really subtle change with 1 to 2 syringes of filler that's going to last the patient many, many years. The alternative to something like this would be having a surgical chin implant, which is definitely more permanent, but of course, more costly as well. And again, like everything else I've talked about, the cost of filler in this area can really range. Often it's based on the number of syringes you need to support that area. And I would say most people need 2, maybe 3, depending on how deficient they are, to see a really exciting result. And the cost of a syringe can really vary anywhere from like $700 to all the way up to like $1,500. Okay, the last thing I'll say about chin filler, and then I'll shut up about it, but I love it so much for the right patient, is that it's still subtle. It's not like someone has filler and then they're walking around their family members or their boyfriend and they're going, whoa, what'd you do to your chin? It just balances and harmonizes the face so beautifully that someone looks more attractive, but you have no idea what they did. And then building off of this sort of chin and jawline concept, the other place that I think can be a really good place to invest in your face, if you need it, is chin or jawline liposuction. It's not uncommon to have some excess fat under your chin, even if you're at your ideal body weight, and that can really blunt the angle between your jaw and your neck. And overall, people are just really unhappy when they get a photo of themselves from the side and they can see their double chin. Even though this is liposuction, even though it's surgery, even though it's usually going to cost a few $1,000, it's still a much more efficient way to spend your money when it comes to sculpting that area. And I'm saying this in comparison to cosmetic injectables like Kybella that help dissolve fat there, or even something like Cool Sculpting that helps freeze fat there. I think a lot of times people think, oh, I'm gonna pick something less invasive like an injectable or Cool Sculpting, but the reality is liposuction is so much better at sculpting that area, and oftentimes the cost is not much more, and sometimes even less. And the really nice thing about chin or jawline liposuction is that it's usually like a one and done procedure. You're not having to repeat the treatments the way you would with other ways of sculpting your jawline. So those are some of the cosmetic treatments I absolutely adore and feel are truly transformative for people without having to spend maybe as much as you would on other cosmetic procedures. And that certainly doesn't mean that other cosmetic procedures aren't worthwhile interventions, but you may see more incremental improvements with other things. One other thing you can consider is if you are cost sensitive, it's not a bad idea to call an office and ask for what their pricing is. They may not give you all of their fees, but sometimes they might tell you Botox starts at this, or laser treatment starts at $1,000 or whatever. And then you can kind of start mentally planning for, is this even worth going to a consultation for, and is it going to be in my budget? I'm so curious, have you had any of these treatments? Tell me about your experience, or if you've had other treatments that you feel like are worth the investment, let us know in the comments. Thank you so much for being here. Don't forget to give the video a thumbs up and subscribe to the channel, and I'll see you next time.